know that urban teens are getting STIs at the fastest rates in the country? 1 in 4 female teens in Boston has an STI, and nearly half of African American girls has a sexually transmitted infection. Teen pregnancy is on a rise for the first time in 12 years. Nearly half of 15 to 19-year-olds in the United States has had sex at least once. Why is this issue impacting low-income youth of color more than other youth? Tonight, we take an in-depth look at sexuality education in Boston and how African American and Latino teens are disproportionately affected with higher STIs and pregnancy rates. We interview teens, parents, and the experts to dispel the myths that parents do not want sex ed in schools and that sex ed just promotes more sexual activity. Joining us tonight is Dr. Prelude from the Center for Sexual Forecast to give us a prediction of what we're expecting for summer of 2010. Welcome to the show, Dr. Prelude.
Thank you. Glad to be here.
So, Dr. Prelude, what are we looking at for summer of 2010?
Not good at all. With all the youth out of school for the summer and the historical low numbers of jobs available to them, we are predicting a hot summer.
What do you mean by hot, Dr. Prelude?
I mean very high rates of STIs and even a spike in teen pregnancy rates, that kind of high. I mean, I'm not surprised. No one's talking to these teens about how to protect themselves. What do we expect?
That's disturbing, Dr. Prelude. Is there anything else we should be looking out for?
If the communities get involved, things might change. But for now, it is not good.
Despite the alarming rates of pregnancies and STIs, there is still no standardized sex ed in Boston public schools. Our reporter in the field, Michelle, visited some area high schools to find out just how much our youth know about sexuality. Michelle?
Thank you, Marilyn. Here we are at an actual Boston public school with actual students, 56% of whom will have sex before graduation. Here's one now.
Yes, I have had sex ed, but it was like 6th grade though, so it hasn't been recent. Like I don't have sex ed classes in high school now, so.
I've had sex ed my sophomore year in high school. It was just like a one-time thing. It was just like a 10-minute experience.
In 8th grade for health class, that was like the only time it was like 30 minutes part of gym class.
I have received sexual education learning in school, but it was like in like an auditorium, and they just said to us, oh, sex, STDs, don't have sex, you're gonna have sex, use a condom.
And then it was kind of nasty at times because we were in 8th grade and we didn't really know that kind of stuff. But it was good to know about our body parts and what they can do.
I do not think my gym teacher was qualified to teach the sex ed class.
That was like assembly, it was like 30 minutes. That was it.
It was around 6th grade, and it was about like an hour.
I think if some health classes taught you some things your doctor would teach you, then there will be less children. There will be less males and females walking around with sexually transmitted diseases.
We've asked students where they get the information about sex. One common answer has emerged.
Porn, magazines.
TV, I'm flicking through the channels, blah, blah, blah. I just seen it.
Porno?
There was like a bunch of like pornos on TV.
Porno.
Before we continue, one quick word from our sponsor.
Empty house, empty house.
Yeah. What are we about to do?
I don't know. What do you want to do?
I mean, that's whatever.
Let's go upstairs. What is it?
Chlamydia.
It's gonna be a joke.
Ew. Marilyn, Ivan, we need to talk. I'm a busy woman. I have no time for this. JP has one of the highest rates of chlamydia in the city. I talked to you guys last week. I've been to 10 crotches tonight, and I don't need any more of this. I know you guys had a fun time at the movies. I was there. To avoid another one of these embarrassing moments, please use a condom when having vaginal, anal, oral sex. Here's a condom. Use it.
Now let's hear from some medical doctors. We have Ivan at Southern Jamaica Plain Health Center. Ivan?
Thanks, Marilyn. I'm here at Southern Jamaica Plain Health Center where we're going to be interviewing some actual doctors like Dr. James Bastian, who's been a pediatrician for 12 years. Let's go inside, shall we?
My opinion as a pediatrician is that it's extremely valuable and necessary for students at almost all ages to receive education about health and sexual health, of course tailored to their developmental age.
What else before you open it?
Don't you have to check the expiration date?
I believe that the topics that should be included in the curriculum for adolescents and sexual health should certainly include the basics of naming the body parts, explaining what the body parts are about, the reproductive organs, talking about reproductive health and the responsibilities of that, so including sexually transmitted diseases, undesirable pregnancy, contraception certainly, including abstinence and the option to not actually engage in sexual activity.
So it's a shot that you take every 3 months.
We also want to hear from a medical professional who works at a city level. We spoke with Nancy Norman, the medical director for the Boston Public Health Commission.
We do not disagree with a plan that has a comprehensive health education program available to all public school students. And I think you would find that our commissioner, the head of the Boston Public Health Commission, agrees with that, as does Superintendent Johnson of Boston Public Schools, as is the mayor of the city of Boston.
Although there are some scattered examples of comprehensive sex education taking place in Boston Public High Schools, for the most part, the minimal sex education classes are being taught by physical education teachers who have little to none training on comprehensive sex education.
So the question is it true that the less teens know about something, the less likely they are to try it? To find out, we interviewed Barbara Husher Cohen, the only person in the entire BPS school system, K through 12, who is paid to oversee all sexuality education in the Boston Public School System. Let's take a look at that interview.
In my opinion, sexuality education should be taught not only to teenagers, but to all children.
It's up to the person having sex using the information that they get. I think it's fair to just give sex ed. It's up to the people if they want to get pregnant or not, you know, if you're going to use it or not. That's what it is.
It's up to you if you want to have sex or not, but wouldn't you rather be safe about it than not be safe about it at all?
My friend, she hits me up and she tells me, oh, the guy cummed on her. And I'm like, where did he come on you? And she was like on her chest. And then I was like, and then she was like, can I get pregnant from that? I'm like, no, you can't.
When I hear like my friends are having sex, I'm actually shocked that I hear that my friends are using condoms, because the education I grew up, I kind of half expect like my friends when they're having sex that I actually expect them that they're not using them. Like I would hope that they're using them, but I actually like when they start talking about sex, I don't even think of the fact that they're using condoms. I immediately think in my head that they're probably not even protecting themselves.
If we had more sexual education courses, I think that it would actually lessen the fact people actually have sex. A lot of friends of mine got pregnant. One of my friends had a STD, so it was like, it's really hard because like you didn't learn anything, so you can't tell them like this is what happened. Like you can say it's go to the hospital because you don't know how to help them at that point in time.
I do know a lot of young people who have gotten pregnant, have STDs and things like that at a young age.
Yes, all my friends are pregnant. I have like 7 that are pregnant.
Even very young children can learn proper names for parts of their bodies. I think they should have their questions, if they have any, answered about their health and about sexual health.
Conversations around sexuality, sexual identity, good touch and bad touch, communication in intimate relationships, talks about what intimacy is, what loving is, what liking is, should start early. I'm having those conversations with my 4-year-old now.
Although the rate of sexual activity amongst teens in the U.S. is the same as that of Europe, U.S. teen pregnancy rates are twice that of England and 4 times that of France. Why are U.S. teens having so many babies?
If you look to Norway and the Netherlands, they have such wonderful sexuality programs because they address sexuality as the way we were created. We were all created to be sexual human beings. We were created to have sexual feelings toward another person. That's what makes us different.
You denied me the right to be loved unselfishly. Back to my heart, turn away from your pain. I said it once, but I mean it this time. Time won't run away. You'll never see my my face again, except for in your dreams. When you think of the love you turned away from me. Time, I'm gonna wait. Now that you're gone, my life is not so clear.
Continuing with tonight's coverage, we have found two parents who decided to speak exclusively with station SEX, saying that sexual education in schools is a good thing to have for their students.
Parents absolutely want sex ed in school. I sit on the HIV/AIDS board for the state of Massachusetts Department of Education, which is now Education, Secondary Education, ESE. And we did a listening tour around the state of Massachusetts, and 87% of the parents in the state of Massachusetts want their children to receive sexuality education.
I think it should be a comprehensive sex education in a Boston public school.
Most of my information about sex came from friends, actually. I would absolutely want my daughter to have sexual education available to her when, you know, she's a little older, when she's middle school, high school age, definitely.
My daughter received sexual education when she was about 13, and it really, really helped a lot.
My lack of sexual education did lead to my unexpected pregnancy.
She knows what's out there. She knows what's safe, not safe. She knows a lot about STDs. She has a lot of friends that are the same age as her, and they don't know much about any of that stuff.
And not having had sexual education, I wasn't as careful as I could have been.
I wasn't ready to talk to that with my daughter, but I put her in the group that I knew she would be safe to talk about, she will learn the right things. Now that she's 17, I feel more free to talk about those things. Sometimes she says if she feels weird to hear me talking about it. If you as a parent not gonna be ready to talk about it, so you need to find a way for them to learn the right way.
From a lot of parents don't feel comfortable. A lot of teens don't wanna hear, you know, like a guy doesn't wanna hear his mom talking to him about sex. And vice versa, you know, like even a girl wouldn't feel really comfortable, you know, going into details with her mom, well, what happens if this happened, because it's very uncomfortable. Parents should be completely open and happy, and they should be asking school officials to bring, we're not asking, demanding school officials to bring sexual education into the classrooms.
Well, there you have it, folks. According to a study done in 2004, 93% of Americans agreed with Maria and Galicia and want sex ed in schools. Unfortunately, only 5% of American teens get the sexual education that covers all the information they actually need. We'll continue with our coverage on this hot topic after a few words from our sponsor.
Stephanie, I just had unprotected sex and I don't want to get pregnant.
Oh no, is there anything we could do now?
I don't know.
I'm Plan B Man. Looks like you need a visit from me.
Plan B man, what can you do?
I'll let my handy voiceover tell you guys about me.
Plan B, aka emergency contraception, will prevent pregnancy up to 5 days after unprotected sex. Plan B is available at your local pharmacy for people ages 17 and older for a low price of $49.99. Or ask for Plan B for free from your doctor, no matter how old you are.
Thanks, Plan B man.
No problem. I'll see you guys in the future.
This just in, not all youth are heterosexual.
So, I'm gay.
You what?
I thought I seen you from under that star. I'm gay.
But why did you waste? It definitely depends on what school you go to. Because like my school, if you had, well, we do have sexual education in our curriculum. And I just feel like because it's there, it like makes it more open. Like, all right, this person's gay. I'm okay with that.
My class wasn't even called sex ed. It was actually called health class. But if it was one thing I think I could have learned, I think I would have wanted it from both aspects, like a heterosexual sense and a GLBT sense.
I would have wished I would have learned more about sexual relationships in sex education. Because growing up, I've always known I was gay from like middle school on, but I didn't really start identifying myself as a gay male until like my junior year of high school, because the lack of education I had in school, I didn't really know what to call myself. I just kind of did me.
We need to make sure everybody understands that, 10% of the population is gay, lesbian, or bisexual, and that's normal too. You know, there's sort of basic truths that need to be taught that I think folks need to integrate, and it's just gonna create a much more accepting environment for everybody.
Thank you for joining us this evening. For all the people here at SCX Channel 7, this is Marilyn Castillo signing off with a final thought. The American Academy of Pediatrics, American College of Obstetricians and Gynecologists, American Medical Association, American Public Health Association, Institute of Medicine, and Society for Adolescent Medicine all support comprehensive sex education. We don't want to get pregnant or get STIs.
If you give us comprehensive sex education, it doesn't mean we're going to become more sexually active.
It means we're going to know how to protect ourselves.
We need condoms available in our schools.
This is the best way to decrease our STI rates.
This is the best way to decrease our unwanted pregnancies.
Our parents support sex education in our schools.
They want us to stay safe.
Not all of us are heterosexual.
We need to include the LGBT community in our sex education.
We are all figuring out our sexual identities.
Our community is disproportionately affected by unwanted pregnancies and STIs.
This isn't our fault.
It doesn't mean we're having more sex than other teens.
Our sexual health and overall health is a result of larger factors.
Like housing,
education,
and race.
Our fight for sex education
is part of a fight for health equity.
And we want to start fighting for that now.